is where you willfully mislead somebody, knowing that what you're saying is factually incorrect.
I think I lie very well for my profession.
What does a liar look like? What does a psychopath look like?
I just want to say I hope there's a lot of criminals listening to this. You'll be picking up some good tips.
And hello, Bradford.
Hello, Stephen.
And as I always say, you're looking well.
Oh, thank you very much. First lie. There we go.
How's your week been?
Not bad. I was in Tasmania on the weekend.
What were you doing there?
Did a gig in Launceston. Well, it was near Devonport, actually. I flew over to Launceston.
Just for the one gig?
Yeah, it's just the one. Just flew over Saturday, came back Sunday. And, talk about, the airport is such a hotbed of deception, Everything is just ridiculously expensive. And I always think if only they were near some kind of transport hub, but yeah, it was fine. I got in, I got out, and it was a footy club. Hello to the East Ulverston Football Club, and just outside of Devonport. Good times, and the weather was beautiful. If you're going to handle 14 degrees, it was just sunny. It's so picturesque there. It's beautiful.
And were they a good audience?
Some of them.
Do you find that there's a difference between different audiences from different states? Like, I guess it depends on your material.
Well, yeah. Look, I've always said to people, I find that the culture, we don't think that stand-up comedy is only kind of really about 50, 60 years old. And in Australia, it really only had its resurgence from about the early 70s. Pardon me. And there's been two definite streams of Sydney and Melbourne. And in Sydney, I felt like that the audience were perhaps far more likely to heckle people, to heckle comedians.
Yeah.
And the comedians would be far more likely to deal quite severely with people who heckled. And you can't tell which came first. Is it symbiotic, or is it, that the comedians see other comedians being harsh and so they antagonise audiences, or do, and I relate a lot to what kind of sports people play, and they play rugby league up there, and it's brutal, so maybe that's why they yell out.
Interesting.
And in Melbourne, we go to the theatre.
Is that because Melbourne people, for the people listening in Sydney, we're more cultured, or?
Yeah, well,
everybody
knows Steve said that, just in case I go to Sydney.
Yeah, just direct your hate mail directly to Brad, thanks. So
what about you?
Interesting week. I was in Sydney. I flew up there to do a test, and talking about airports, I was at the airport, and I like my coffee. I'm a bit of a coffee addict, and I thought I'd buy a coffee from the airport, and it was the international thing. Have a guess how much for a coffee? Pretty much like a little bit smaller than that.
$11.
$9.40. For one coffee.
Yeah.
Seriously. It's like the old days when you used to go to the movies, and you choc top, and they'd, $14.62 or something. How do they get away with it?
Look, I don't know. I think the mafia look at the airports in jealousy. And you go, how do they get away with it? I went up to do a gig in Sydney once. So it was a corporate gig, and the deal was I flew to Sydney, I hired a car, drove to the gig, drove back, got on a plane, flew back. When I was getting the car from the hire place at Sydney Airport, I said, "What's this $7 charge?" And they said, "Oh, that's what it costs you to leave the airport."
Airport tax thing.
And I said, I could understand that if I'd driven my car here, but
good point.
Somebody drove this car here other than me, and they just said, and a very Sydney answer. Do you want it or not? No, yeah, all right, I want it.
That's where they got you by the, what.
But my mate, when I lived in Sydney in the 80s, my mate was refurbishing a restaurant, and a guy came in from the Sydney City Council, purportedly from the Sydney City Council, and he said, "I'm here about your ice cream licence." And Tony goes, "Mate, it's an Italian restaurant." And the guy looks at him and he goes, "Gelati." And he goes, "Listen, it's $500 or $200 if you give it to me now." And that was my introduction to Sydney. Anyway, so we have a guest, and I've been talking over. It's my fault.
So we're lucky to have Dr. Nicole Yap, who is an oncoplastic surgeon. Now, I didn't know do you know what an oncoplastic, before I throw it over to Nicole, do you know what an oncoplastic surgeon is?
No, but I
Have a guess.
noticed the connotation with the onco word, which I relate to cancer.
Correct.
And so an oncoplastic surgeon perhaps would be repairing disfigurement from cancer.
Well, I think we should throw it over to Dr. Nicole Yap and ask, what is a oncoplastic surgeon?
Well, Brad, you're exactly correct. And I'm so pleased, Steve, that you said onco, unlike another introduction I had, which was oncoplastic surgeon. And I had to describe
I have seen you play golf.
I just thought to myself, how do I answer this question? But yes, you're quite right. And oncoplastics can apply to a variety of areas. Obviously, the areas that are involved are ones that are on the skin surface rather than internal. And that would happen to be all skin lesions and their repair, especially on the face, and also the breast. So I sort of do both, but breast is my most challenging, and I like challenges. So that's why I sort of focus on the breast cancer and the reconstruction thereof at the same time, which means that someone may come in feeling pretty poor about themselves because they have a cancer diagnosis, but in fact thinking, because there's all these sites, I've looked at them, especially in America, they like showing themselves all disfigured and it's okay, all power to women. However, it doesn't always have to be like that.
Yeah.
And you can go into an operation and you can come out looking maybe better than when you went in.
Okay. And did you, it sounds, well, not niche, but it does sound quite specialised. Did you generally do plastic surgery and then specialise in that, or?
So I started off in my training in plastics, and then to do cancer surgery, you have to do general surgery, which assists with all the oncological aspects, including lymph nodes, etc. So I did that, yeah.
Okay. It fascinates me. People say to me all the time, well, quite frequently, people say, I couldn't possibly do stand-up comedy. And I always say to people, I could not possibly back myself to cut somebody open and not have them die.
Yes, well, it was my first experience of an actual procedure with a general anaesthetic, because I used to be the one, as a medical student, I zipped down to emergency, and anything that needed like a tip of a finger amputated, I'd do that and cut up lacerations. But the first instance was an appendix, and I was on, and I was quite junior, and in fact I'd never done a procedure by myself. I've always done it with the boss. And we knew that we called them a hot appendix coming in through emergency. So there was a hot one that came in, and I rang my boss, who was on Channel 31 at the time doing a Tai Chi episode. And it was back in the days when they had the very big telephones, the mobile phones, and that he had them hanging off his waist. And we were actually watching him on TV in the tea room in theatre as he answered my call. It was, hello, how are you? And I said, I think I've got a hot appendix. He goes, okay, I'll be there in a minute. You just set it up and get started, and I'll be there to do the main thing. So I thought, okay. So I slowly got ready, got started, looked up where to make an incision again, 1/3, 2/3 from the umbilicus.
Is this Google or?
It was in my notes. And then I thought, I feel like a Chevy Chase movie, because when they go doctor, doctor, and one's underneath the actual surgical table telling him how to do it. Oh, yeah. If you've seen that movie,
no, but that's
but it was very much like Chevy Chase, and that thought crossed my mind for a brief minute in time, and then I thought, oh no, just better focus. So I was speaking out aloud as I was doing the procedure, and the nurse, who had been around for a long time, and she knew exactly what to do for these simple appendixes, was saying to me, every time I gave an instruction of my next move. And I opened up the peritoneum, which is the lining to the abdominal cavity, and literally out popped the tip of this very inflamed appendix. And I was so relieved. I went, and that, trying to sound very professional, that is the appendix there. And I looked at her like, is it the appendix? I said, that is the appendix there. And she went, that is the appendix. And I went, oh, thank God. And that was my first time I've actually ever done a procedure. And that particular night, my actual consultant was on for quite a period of time on Channel 31, so he didn't actually get there for about 3 hours, and I got through 6 appendixes, 6 more that came through, one after the other. And by the time he arrived, I was on to my 7th, and he goes, oh, what are you doing? And I said, appendix, they've just timed me, I can do it in 9 minutes. And he said, he was very competitive. He said, I will do this. Okay, fine. I went off to have a coffee, and they said, came into the tea room afterwards. I said, I did it in 6. And I went, okay, but let me look at the wound, because I'm very particular about how wounds look.
Oh, yes. And that's why you went into plastics.
Yeah.
You like the finish. And I love the idea that I like the idea that somebody would come in with an injury because they tripped over, and you'd have to have an onco-surgeon.
Yes, well, that was me. I'm the onco-surgeon.
Yeah, well, that's interesting because there is a slight element of deception in there, and it's I'd say, like, if on a scale of 1 to 100, it's about a 3, which is where you kind of bluffed it out and went, that is the appendix, isn't it?
Yeah. But talk about patience. So I worked in emergency doing as a plastics trainee, and it was at Dandenong Hospital, and it was so busy, full of people trying to escape police, get into houses surreptitiously, not with keys, and and on a couple of occasions they were climbing fences or going through windows which were a little bit jagged after they threw the brick through them, and they cut their fingers. And as usual, when you see a patient, you ask for the history. So I'd say, oh, okay, knowing exactly what had happened, because there were dime a dozen like this. And he said, and so what happened to you? Oh, well, I locked myself out of the house and I decided to go through the bathroom window. The bathroom window, yes, because it's the smallest window. And as I went through there, and you just knew that next minute the police will be rocking up saying, we're looking for so-and-so. Yeah. And I'm just going, I'm just fixing the finger.
Yeah, we say, can you match this finger to somebody with 9 of them? So it's, I suppose the first thing we wanted to look at was the deceit, or the lying, or whatever you want to, just the exchange of information between medicos and their patients. My contention is that if you actually wanted to know how much alcohol was drunk by Australians, and you actually went to their doctors, you would find that was a lot less than was really drunk, because so many of us would say, oh, about 3 or 4 drinks a week.
Yes, I would assume a lot of patients don't tell doctors or their GPs the truth.
Oh, yeah.
What do you find?
Yes, we're kind of used to it though, because people don't like to look bad. Yeah. And it happens with both smoking and drinking. Yeah. And now the new wave is the Ozempic. They want you to think they just look like this. Because it wasn't Ozempic. And it's really important that you know about all of these things for the outcomes post-surgery. So I remember if you're a smoker, you're going to have poor blood supply because of the nicotine. So when you're doing a breast reduction or anything to do with the nipple areola, it's the point of least blood supply, because it's the end point of where the arterioles go to. So you know that if they're a smoker, the last thing you want to do is lose the blood supply in that area. And so what happens is that I say, are you a smoker? And if you are, I'm not going to do certain things for you because I know the outcome could be quite tragic. So I ask them, no. And you can sort of smell the fisherman's bend coming from the breath as they say no, because they often use that to try and hide the smell of smoke. And so I decided, do you really like fisherman's bend? And they're going, no. So why are you having it? And then and then they tell me. Right. But I did have one lady who was downstairs and she would chain smoke before she came up to me. And in the consulting suite, and I said to her, "You want a breast reduction? You are going to lose your nipple areola complex." And she goes, "Oh, I don't smoke. It's my sister that smokes." And I'm like, "You must smoke. I can smell it all around you." "Oh, I spend a lot of time with my sister," and we caught her out, and she lost a nipple areola. So,
and she was. Well, I'm a surrogate for my sister. I smoke.
Yes, that's
for
it.
her benefit.
Yes.
Yeah.
You see, that makes no sense to me. If I'm going to go in have an operation, you would think that you would be upfront with the surgeon or whoever's operating, because you don't want to have a problem later on.
Yeah.
So, and as you said, there could be complications as a result of that. So are there some cases that you would refuse to operate on?
Yes.
What would they be?
Especially with smoking.
Yeah.
So, and reconstruction. I'd say no reconstruction with smoking because of the blood supply issue. And there would be probably not so much skin lesions, but in areas with natural poor blood supply, I just would say no. And then you'd say, they'd say, well, if it's something which you can do in the future, they go, how long, if I stop smoking now, how long will I have to wait? And that depends on how long they've been smoking for and how much they've been smoking per, say, day or, per week. And so you add that up and then you know exactly.
I stopped, it's July now, I stopped smoking about 8 or 9 years ago, so, but I don't think you can do anything with this anyway.
Your breasts. What are we talking
I
about?
was pointing at my face.
She's a breast surgeon.
I know. I'm here to make light. So that's one point of deception, and it is understandable because this is something that we constantly encounter in, and you would many a time, even a criminal doesn't want to admit that they're a bad criminal. Because we are embarrassed by our failures and our failure to meet certain requirements. But I think there would be an algorithm, I imagine, that somehow means that the severity of what you're facing may induce more honesty.
Not really.
No?
No.
Okay.
It's amazing how the power of the mind, the patient wants you to believe that they are better than they are.
Yeah.
And so they would rather, on many occasions, they would rather lie about certain things than let you know, even though you do know because you've got all the signs. And I just pretend I don't until I say to them, look, seriously. But they often will continue to lie. Look, for example, Ozempic and the other types of like Mounjaro and Wegovy. Yeah, all those similar.
Sorry, what's Wegovy?
They're all the similar GLP-1 agonists which help lose weight, help the patient lose weight, and they really don't want to tell me this because are you on any medication? No, and you can see this hollow cheek.
Yeah,
are you sure?
Yeah,
no, and okay. I said because you could die with an anaesthetic if you're on the. I just mentioned Ozempic or similar drugs, and they're like, well, actually, what? Oh, sometimes I take it. Sometimes, like either the weekly dose or the monthly dose, whatever it happens to be, whatever they're on, and I'm like, really? Because it's true. I'm the one that gets into trouble from the anaesthetist. Why didn't you tell me? Because I didn't know. Did you ask them? Now I'm like, make it a specific thing to ask. And if they say they're not and they actually are, then at least it's not my fault. I note it down. But they could aspirate.
I had a very interesting situation where, as we came out of COVID, out of the intensity of it, I've had COVID 4 times. I think up to this point I'd had COVID for a 3rd time, and I was having a procedure that was. Leading to my brachytherapy because I had prostate cancer. And I got through a telephone interview. I won't say the hospital. I got through a telephone interview and a clerical interview and then a nurse interview. And then each one of them I said that I had COVID within the past 6 weeks. and I still got through. And I was lying on the trolley, and the anaesthetist came to see me, and she was holding my hand, actually working out where she was going to put the cannula, or and she just casually said, "Oh, you haven't had COVID lately?" And I said, "Yeah, well, I've told everyone I had it about 4 weeks ago." And she dropped my hand like it was 2,000 degrees and just went, "No." And I went, "No." And I said, "Well, because I'd been delayed anyway, and I really wanted to have this procedure." And I said, could we say 6 weeks? And she was just like, not going to touch me.
So what's the story there? They didn't want to operate because you had COVID so many times?
No, the protocol then was, I don't know, you'd tell us if it's changed. The protocol was that if you'd had it within a certain amount of time, then you were compromised.
Oh, yeah.
And it would be particularly, and given that I'm oversized and that I have a sleep apnea and a history of, smoking back in the day, I was already, I suppose, line ball. Not everybody's like I've had another operation where the anaesthetist said I took this on because I like a challenge. That's what you want to hear. How many have you lost? But yeah, so that was my understanding. I don't know if it was 6 weeks, but whatever it was, and she was absolutely just changed, and that was the end of that. I had to get rescheduled.
That's an interesting question. So, is it the responsibility of the surgeon or the anaesthetist to ask those questions about, whether or not you've had the COVID?
I always say the anaesthetist. I'm not responsible.
But would you be in charge of that?
Yes,
operation?
unfortunately, I am in charge. So by default, I am, yes. But these are the sort of things that the anaesthetist needs to ask, because they're the ones that are managing the airways. I'm not a thoracic surgeon, so or ENT, so they're managing the airways. But the other issue with regards to timing is also COVID and those sort of viruses are aerosol spread. Yeah. And so if it gets into potentially on the equipment they're using to intubate you or whatever's required at the time, potentially it may pass on to someone else.
Yeah.
But aren't they all sterilised and stuff?
Yes, but it just have to be super safe. You just don't know. Things can go amiss.
But it was interesting that I'd got through, and I'd been absolutely upfront, right? Because I'm not, I know I'm a risk. I'd been absolutely upfront.
Yes, I've seen you drive.
You've only ever seen me park. I couldn't believe that I got through those 3 interviews where it was clearly it's a red hot button question. And I thank her for her diligence, because this may be otherwise just the two of you doing this podcast.
Wow.
Now, but that's one side of the coin, and there's other ways that people are dishonest, I suppose, to the physician. But
the other day, I've just bought a new car, and I couldn't find a spot, so I just sort of parked it fairly close to my rooms at another area, which the rooms are right close on the ground floor. And I don't like my patients knowing all my bits and pieces. Anyway, this one of them came in and she goes, "Oh, is that your car parked out there?" And I'm like, maybe.
Yeah.
And I'm not very good at lying because it was written all over my face. So I think it's both ways to a certain point. But I think at the end of the day, we're really not that interested in everybody, as far as they don't need to lie to us. It's just how people like to present.
Yeah. So I would assume that a number of years ago I was asked to speak at the Royal Australian College of General Practitioners in Sydney, which sort of amazed me why they wanted me to talk to all these GPs. And the president of that organisation said, "Yeah, look, what happens is a lot of doctor shoppers, is that what they call them? Shopping for drugs or codeine or whatever it may be." And they wanted to upskill their ability to read patients. But I found that interesting, because I thought you would see, every time I go to a GP, patients are going in and out, like God knows how many patients per hour. So you'd think you'd get the skill sets or ability to realise when people are lying to you. Have you found that?
Some of these patients are pretty good.
Yeah.
When you really want something, you can, it's like the the world it's like a play. They're on stage, they want this. So I think, you'd know that in other areas.
Sociopaths, they're going to be able to come in and put it on. And plus, they've got all day. They call them doctor shoppers too, because they ain't just seeing one doctor. You know, you can probably, you can probably do quite a few between Tarneet and Durack. You know.
Well, I used to work at St Vincent's when I was training, and St Vincent's has the only in the public, and they have the prison ward, and we'd often get prisoners trying to get out of prison. Right. And so it was really interesting because when I was on, I'd have to go and see them all shackled and whatnot down in emergency. This is where they delivered them. And they'd see me and they thought, it was easy.
Push over.
Yeah. Oh, little did they know. So I would watch and see, first of all, I'd find out what the pain was. And if they said it was something which they were expecting it to be, they would actually tell you, it's my appendix. Well, they didn't know I'm the best appendix person since the world
9
started.
minutes.
Yeah, I can do it. I can diagnose an appendix on anyone, especially males. And so, so I just looked at them, and if they were writhing around the place, I knew that they didn't have peritonitis, because you can't. When you've got peritonitis, you're just flat and you can barely breathe or talk or move because it's so painful. And when they're writhing around, if they knew their stuff better, they would have said they had kidney stones or renal colic. Yeah. That's when you writhe around. So I already picked it. He goes, I've got appendix. And he's, and I'm like going, I don't really want to touch him because he might give me some disease. Yeah. And so I put him through the scan or whatnot, but I don't think you've got a problem. And as soon as I said that, they started screaming and yelling. And I really knew I was right. Yeah. So I was being lied to once again.
Yeah, but so you have the ability with, CAT scans and MRIs and all that to back up your opinion, I guess, but obviously knowledge. I just want to twist it a bit. We're talking about patients that would lie to their GPs or doctors. What about the other way around? Brad and I spoke about this a couple episodes. If I had to deliver a death message,
yes,
I would, there were times that I lied because it was quite a traumatic event for family members to go through.
Just to remind people, you said that somebody had been, and the question was asked, did they die in pain?
Correct.
Yeah.
And I lied. I said no. And I thought, do they really need to know that their loved one suffered? And I remember talking to my partner, and he agreed. And I mean, I don't know what our listeners think, but send us a message what you think, if you think that was the right thing to do or not. But anyway, and it made me think, especially in your line of work, Nicole, are there times where you sugarcoat might be the word?
Definitely. That example you gave, I've had experience in that too, especially as a junior, because they made us do all the dirty work. So you deliver the message. So I'd be there, and especially if you had a lot of family, so a lot of the Mediterranean people there'd be multiple people there.
Generations.
Yeah. And I knew that if I told them, there'd be a lot of wailing and loud noise. So I thought, so I would come out and I'd say, right, the person's obviously passed, and they don't know this at the time. I said, not doing very well.
Right.
Almost in peace, but if you go in there, you'll see they're resting peacefully.
My goodness.
And that's how I started it. I didn't say that, and then they can just peacefully go. So it can be in the time that, I mean, this is just a recent event, so they're not cold or anything like that, but I could just do it so that they could get warm up to the idea.
Okay. Yeah. Well,
it's like Professor Paul Ekman calls that a pro-social lie.
Yeah.
It's if you had good lies and bad lies, that would be, I guess, considered a good lie, because you don't want to put families through further pain and suffering and anguish, I would assume. And I think we do it in just about every occupation, don't we?
I think so. I've the amount of times I've said to an audience, "You're a wonderful audience," they are not a wonderful audience.
Well, what would you say, Steve, if if I came in and you were the patient and I said to you, what would you call this lie? I am the very best surgeon you will ever get.
Well, firstly, I would do my research to see if that's true.
Okay, let's say there's no such thing as the very best. It's one of the
I
best.
have an answer for this too.
Yeah. So you're saying to me, to try to impress me that I should use your services for an operation. Well,
you might say to me, well, I might just go and think about, let's say it's an elective procedure, and we're not talking about cancer. And I would say to you that statement, meaning, well, you don't need to go any further because I am it and a bit, which obviously no one is it and a bit.
Yeah, that response would concern me. There's one thing having confidence, but there's also another thing having the skill sets and ability to perform on that confidence.
Is there a label for that?
Deceptive. I mean, I look at it from the perspective of, we all like. I mean, if I'm going to see a specialist, I want to make sure they can walk the walk and talk the talk. However, I don't know. I personally, I like the quiet achievers, and people will tell you who, and I'm sure you know this yourself. In fact, just today I was talking to somebody who had a shoulder operation, and I said, "What was the name of the surgeon? What was he like?" And he said it was fantastic. He does a lot, and it's like anything, word of mouth, I guess. But I'd be concerned if that was the surgeon's pitch.
See, I'm the opposite.
Oh,
I want confidence, right? I don't.
You can have confidence, not necessarily ability.
Yeah, but look, it's kind of like if I'm sitting on the plane, if I'm in business class, like that happens, but I'm sitting in business class and the pilot gets on the plane and stumbles as they get on, I think about getting off that plane because my confidence in that pilot has been affected, and that's
What if he just tripped on the step?
Of course, he just tripped, but this is not an intellectual reaction. This is it's a fight or flight reaction. It's just like I've lost confidence. My heart guy, who's just awesome, I love the fact that he's so confident. I'm sure that I could be expiring on the floor in his rooms, and he'd be going, "You are having the best heart attack I've ever seen." That's kind of what I want to see. Even when I do a joke about when I had my gallbladder removed, and he was very confident. He did a great job, but he did, was it keyhole surgery on me, and I ended up with 4 little scars across my abdomen and a slightly bigger one on the right hand side. And he came to see me, and he was so confident, and he came to see me, and he said, "What did you think of my work?" And I said to him, "I'll be honest with you, Mark, it looks like you didn't know where it was. It's like, have you ever heard of dial before you dig?" Because it came out of the big side. And I watched all the confidence just ooze out of him. But that's, for me, and I can detect, braggadocio, and I can detect when people aren't going to be able to walk the walk. But I really don't want anybody to look on the wrong side of me to see where my appendix or my gallbladder is. And so I don't, and also too, because I feel like there's a, and this, I could be very wrong here, but I feel like there's a high degree of spectrum on people who have the confidence to cut a human open and remove bad bits of them without killing them. I think that, that you.
Are you saying I'm on the spectrum?
I
liked you before, and now I'm not so sure.
Okay, well, it's if I had $1 for every time people have said that, this is going the way of all my associations. But I don't know. It's something I associate with that kind of confidence that you. How did you feel on your 6th appendix? I
was pretty confident. I could whip them out like left, right, and centre. The 6th one took me 9 minutes, and they were timing me. That's what was happening, and I was washing and cleaning and having everyone perfect. But actually, the funniest thing was the next day when I went round to see them all, I was more interested in the scar. It's quite good, isn't it? And they're like, "I'm in a bit of pain." but the scar's good.
Yeah, you see, you're already thinking about where you're going to specialise.
Hence the plastics.
In another hospital I was in, I had a doctor try and put a cannula in my left fist, and he had to use an ultrasound. And I thought, well, you should not be a surgeon.
Why are we using an ultrasound to put a?
Because it's hard to see where the vein is and feel it.
Don't they tap it like on the movies?
Yeah, you see that blue thing there?
Yeah, but it might have been collapsing. So I don't know why they were doing the ultrasound for the vein. Maybe they were just practicing on you.
I ended up having a transfusion.
So we usually use an ultrasound to put lines in the arteries because they're a bit lower, and you don't want to go through an artery because you'll have a little bit bigger bruise. But not necessarily on the vein. Right. I'm not sure what happened there.
Well, it just seemed to me like he was lacking confidence about doing that, and I thought maybe just
maybe he's just practicing.
Yeah, well, I'm not a training drill. So it would be fair to say that when there's difficult things to be said, do they train you on how to say these things?
Well, I'm not sure what they do these days, but I was never trained.
Yeah,
I just decided to do what I thought I would have to do if I was telling someone in my family about a bad situation. Yeah. So I thought, well, that's how I'll do it. But it is quite confronting. I think you would agree, having done it. But we weren't trained. We just had to produce the goods. But if I really got fed up with people just going, well, especially if they've been causing us grief, because in the public hospital or in any hospital, but especially public, I noticed that they even have code greys. Yes. Code grey is for bad behaviour, usually emanating from the patient or their friends or family. So, and that happens quite often. So nurses and doctors are attacked all the time. Yeah. And after a while, you just get fed up. You're going, all I'm doing is trying to help you.
Look, there's another level of not deception, but misdirection there, if you like, because they seem to have the voice of whoever does that in the hospital. They seem to have a certain kind of person who has the most reasonable voice. It will be something like Code Grey in 3 West. Code Grey,
and that's where it's all
West.
Turning to
and it's like, and you can imagine in 3 West, it's going off.
It would have to be to call it Code Grey. It usually has to be.
So just quickly, is that one of the worst? That's we need help. It's like a Code 9. So police parlance.
Code Grey is violence. Right. Code Black is pretty much like a bomb or something, a bomb threat. And then you have the Code Blue is a cardiac or respiratory arrest. Yeah. And then there's the Code Yellow, which is
you can just get there before the light changes to red.
Yes, pretty much. There's no Code Green, I'm afraid, but there's a yellow, and that's like spillage of could be anything.
There is a Code Green because it's been called on me. Where they go, there's a minor celebrity in the Ritz at the Alfred, and all of a sudden people walking past going, I don't recognise him.
Don't you know who I am?
I have that tattooed on my chest. Don't you know? And on my back.
That sounds like an Eddie Izzard from the Death Star Canteen.
Oh yeah.
Do you know who I am?
You know
I'm Darth Vader, not Garth Vader.
No, you're Mr. Vader. Anyway, yeah. Well, that's.
Well, firstly, thank you very much for your time, Nicole.
It's been wonderful.
And
it's a pleasure.
Just before we wrap up, what's the biggest lie you think you've ever been told, whether it be in work or no? Let's keep it to work.
Because if you're going to say I would have said, it's not you, it's me.
Yeah,
that's a common one.
Yeah, it's been great to have you. We'd love to have you back too. Obviously, you know where you work and where you have worked, you get to see human behaviour, and that's really what underpins this podcast. So thanks very much.
Thank you.
All the best. Thank you.
Cheers. I just want to say I hope there's a lot of criminals listening to this. You'll be picking up some good tips.